Ma, I took contraceptive yesterday when I had unprotected intercourse with my partner. Now, later on the next day, we also had another unprotected intercourse. Ma, will the emergency contraceptive I took yesterday protect me from the intercourse I had the next day? Because I feel like since I already took the emergency contraceptive after the first time we had a protected intercourse, I feel like, okay, there was no need of taking another one because, you should be able to still protect against the next one that I now had later on. Now listen up, let me tell you. Emergency contraceptives are supposed to prevent pregnancy from an unprotected intercourse you are having now. Like on the spot, as soon as that intercourse happens within 72 hours, you take emergency contraceptive, which is within 3 days. All right, it's not even up to 3 days as a whole, so you have to count from the very moment that ejaculation happened till 72 hours later. So it's better you wait and have all the unprotected intercourses within this time, and then you decide to just take the emergency contraceptive at once. Because if you take the contraceptive now, and then in the next 24 hours you're having, or 12 hours later you're having another intercourse, that emergency contraceptive you've taken is not going to protect you from the future the future intercourse. It's supposed to protect you from the now event and not for future intercourse you're going to have. So if you are thinking that what you took yesterday will protect your tomorrow's plan of intercourse, it's a no-no. It might fail you, and at the end of the day, you will find yourself being pregnant. Now, in as much as I've got people on my platform who wants to have babies, I've also got mothers who wants to child space. I've also got people who are not ready yet and they don't even know what method of family planning to use. So I'm here to actually educate you about family planning. It is simple. It's just a way of taking charge of your fertility. It's just a way of having babies when you plan to. It's just a way of you being in charge of everything. Maybe child spacing, you've literally just had a baby, maybe it was even through CS, and you're being careful, you don't want to get pregnant immediately again. That's where family planning actually comes in. So a lot of people after childbirth, they are so scared that they rush to go and put implants on their arm, or they put intrauterine contraceptive device straight into their womb, and it now starts causing them a lot of troubles. There are so many consequences of having artificial family planning methods. So we have two categories of family planning. We have the natural method and we have the artificial method. Now, when we talk about the artificial method, we are talking about the implants, the intrauterine contraceptive devices, the injections that you take every month, the pills that you have to swallow every day. These are purely artificial methods. Okay, now in the case of the implants, what they do is release this contraceptive hormone slowly into your bloodstream. Imagine having an implant for 3 years. Imagine having it for 5 years. Your body has already gotten used to all of this. In your bloodstream, the level of this contraceptive hormone is now much, such that it prevents you from ovulating. So when you are now ready to get pregnant, it becomes a bit challenging to reverse it immediately, in as much as we are told that it is immediate reversal. As soon as you take it out, you're getting pregnant immediately. Sometimes it doesn't really happen that way. It takes the body quite a while. So I've had messages like, I did family planning, but I removed it since 3 months ago. Up till now, I've not seen my menses. Now, it actually delays a lot of things from restarting again. Now, for those of you asking me, how do I restart my menses? I've taken my family planning out and up till now it's not coming. Go to a pharmacy and buy a medication called Primolut N 5 milligram. And I'm not going to tell you what to do, but for those people who have actually inboxed me, as soon as you tell me, I will ask you to buy it, and you will snap and send the drug as a proof that you bought it to me, and then I'll tell you how to take it. Primolut N is also a hormonal medication. It helps to treat some menstrual disorders. So when there is a delay like that, I ask people, buy Primolut N 5 milligram. It works like magic. You're going to take 1 tablet every day for about 10 days. And now you're going to keep to the exact timing. If you're taking it at 8 o'clock in the morning, you make sure it's 8 o'clock every day until your menses starts. It might be that immediately you stop the medication after the 10th day, it is like 3 days later that you see your menses. For some people, before they even stop, before they get to the 10 days of taking it, their menses comes. But eventually it will come. So this is me saying, instead of going for the artificial methods of family planning, like putting an implant, IUD, injectables, pills, can you opt for the natural method? That is why I have been, teaching every day about, how to get pregnant. So if you turn it the other way around, it's how not to get pregnant. Okay, so you should be able to take charge of your fertility. What are the natural methods of family planning? Number one, protective method, or you call it barrier method. Now, this barrier method involves the use of what we call condoms. It's not only the commercial sex workers that uses condom as a form of protection. Even husband and wives, if you want to go for natural family planning method, you can opt for barrier method, which is use of condom on days that you are not safe, because it is not all the days in the month that pregnancy can occur. After your menses, the first 4 days, pregnancy will not occur, and the later days, just before your menses, pregnancy will not also occur, even if you have unprotected intercourse. So in between the times that you are fertile, you can use barrier method, which is use of condom, either male condom or female condom. Another method is withdrawal. So the man can actually practice how to actually withdraw before he ejaculates. He withdraws his male instrument and then releases outside the female body. It doesn't ejaculate into your VJ. Now, this comes with regular practice, okay? But that is a natural method of family planning. A lot of families, a lot of couples, a lot of partners have been using this method for long, and it is working for them. Instead of endangering yourself, instead of actually putting an implant or putting an artificial method of family planning that will cost you a lot of complications in the near future. Another method is studying your cycle, calendar method. It is also a natural family planning method, like looking at your calendar, marking the days. If my menses started today, I'm just going to tick it on the calendar. As soon as it stops, I'm going to tick it, and I'm going to count 4 days after that menses, and know that, okay, even if I have intercourse, I'm safe. I'm not going to get pregnant. After the 4 days are over, you just know that you've entered your fertile period and you stay clear, or you use your condom, or your husband withdraws when it's time for him to ejaculate. Then just few days to the resumption of your menses again for the next month, you are free. You can actually have unprotected intercourse, enjoy yourself without the fear of pregnancy. That's calendar method. Some people use their cervical mucus to know. Every day you insert your finger and you see the changes, when it is thick and like a pap, that you're not, the pregnancy is not going to happen. When it has changed to very creamy, and when it changes to very stretchy, that period is very, very sensitive. But this comes with expertise. If you are not really, really good with cervical mucus method, I wouldn't advise. So the best and easiest method is condom and withdrawal. This has to do with the both partners studying themselves, and the man really, really trying to learn how to withdraw when it is time. I know it's not easy, because that's the ecstasy, that's the point where you're already climaxing, so it's not going to be easy, but it's something that is possible. People are using it because women, after artificial family planning method, have developed complications like spotting in between periods, irregular menses, hypertension have been developed, high blood pressure. I know of a woman who, after family planning method, she put an implant, she began to have BP issues. And even when she took out the family planning, it was difficult. She was struggling to control her blood pressure. She was using, blood pressure medications. She became overweight, a lot of things. And it will predispose you to some cardiac issues, that's some heart problems. Because when you become overweight, you have blood pressure issues, you will just be uncertain, bleeding, spotting, everything changes. So instead of putting yourself at risk, and I know that a lot of people are just scared. I don't just want to get pregnant if I'm not ready, or I don't just want to get pregnant in between. I just had a baby, I don't want any mistake. You can go for the condom for now, until you have studied your cycle to the point that you are able to take charge of it. Now, you can use emergency contraceptive as a one-off on days where it just happened that, we were enjoying it, and then I just couldn't help but ejaculate into my wife or my partner. At that instance, emergency contraceptive can be used, which is a one-off. So you take it within 72 hours after the unprotected intercourse. It happened now, and you're not going to wait for 3 or 4 days later. It is 72 hours. Now, note that this 72 hours includes both day and night. So you're not counting it as if it's just day. You're counting both the night time that you're sleeping. That 72 hours goes as fast as you can ever imagine. So I will prefer that as soon as it happens, you take it as soon as possible to prevent stories. What does this emergency contraceptive do? It only prevents you from ovulating. Now, let's say you had this intercourse on your ovulation day and you take the emergency contraceptive. It helps to prevent the egg from fusing with the semen. It helps to prevent that your egg that has been released that day from being fertilized by the semen that is released. So it will prevent both of them from even coming together. That is if it was on your ovulation day that you had it. So especially on that day of ovulation, if you have unprotected intercourse and you don't want to get pregnant, please, as soon as possible. A lot of people have taken contraceptive and be like, oh, I still got pregnant at the end even after taking it. That's because probably you didn't take it right, or maybe the drug was expired and you didn't check. Because if you wait for several hours, already you are ovulating. The semen has been ejaculated into you and it has already started traveling up your genital tract. And you don't stand up immediately to go and say, I'll get it tomorrow morning. Before you go and get it, both of them had already traveled. You don't know that this man is a sharpshooter and his semen is very, very active. It has already gone and fused with your own, egg that has been released that day. And both of them have decided to dance and be like, oh baby, I see love in your eyes. Baby is coming on the way. You understand? So it's best to take it as soon as possible before stories that tickle the bum bum actually comes into play. So this is me wanting to explain that you can opt for family planning method, but I would prefer the natural one, which is barrier method, withdrawal method, studying your cycle, which is the calendar method. Or as a one-off, you can use emergency contraceptive. And that emergency contraceptive, please note, is not going to prevent future pregnancy. So if you have an unprotected intercourse today and you take emergency contraceptive today, tomorrow you have another unprotected intercourse, you will need to take another emergency contraceptive because the one you took today is not going to prevent the intercourse you're going to have tomorrow. Understood?